Imagine a relentless crawling sensation under your skin, an intense, violent agitation that makes physical rest a complete impossibility. The patient describes it as being eaten alive from the inside. This panic runs on a strict schedule. The moment the patient gets warm in bed, threadworms begin a violent dance in the lower digestive tract, forcing them to toss and turn until sunrise. Daytime offers little relief. Breathing is obstructed by nasal polyps that physically shift back and forth, blocking airflow depending entirely on which side the patient lies on. Then there is the appetite paradox. The stomach signals intense hunger, but the moment the patient hawks up mucus, a disgusting, moldy taste fills the mouth and kills the desire to eat. The ailments even extend to the seemingly absurd. The simple act of hearing a voice causes heavy systemic exhaustion. And at the extremities, they suffer from a sharp phantom pain that feels exactly like a great toenail digging into the flesh. A doctor facing this combination of worms, shifting polyps, and phantom toenail pain is looking at a highly fragmented diagnostic picture. It is a list of symptoms that do not immediately suggest a single underlying cause. Notice how this diagram splits the human body into isolated jurisdictions. A standard medical approach would send this patient to a gastroenterologist for the worms, an ENT for the polyps, and a podiatrist for the toe. But what if we treat the body as a single entity? What if these bizarre ailments are actually highly specific data points pointing to one unified condition? The challenge is identifying the hidden thread that connects these wildly scattered biological anomalies. In homeopathic methodology, understanding a case like this requires building a pathological profile. Watch how this animation draws lines between seemingly random points. This is an exercise in pattern recognition, grouping eccentric, unrelated symptoms together until a unified, recognizable picture emerges. For this particular patient, the symptoms point to one theme: extreme nervous hypersensitivity and irritation. Once you apply that specific lens of hypersensitivity, the chaos disappears. The symptoms begin to behave in a predictable manner. Let's track this on a wireframe model. In the digestive tract, the threadworms react specifically to the environmental trigger of heat, becoming violent the moment the patient warms up in bed. Panning up, we see a neural disconnect. The stomach signals for hunger, but the nervous system overrides the desire to eat because of that highly irritating moldy taste. In the diaphragm, the simple act of swallowing or nursing triggers a relentless, spasmodic hiccup. The mechanical action itself causes an immediate nervous reaction. Zooming into the nasal cavity, we see that the polyps are not stationary. They mechanically shift position based purely on gravity and the side the patient lies on. Across both systems, the biology is overreacting to mundane, everyday forces: heat, gravity, and the simple act of eating. This sensory rawness extends well beyond internal organs. The auditory system is so hyper-alert that standard input, merely hearing someone talk, causes deep, systemic physiological fatigue. At the extremities, the hypersensitivity mimics actual physical trauma. The patient feels the distinct pain of an ingrown great toenail, even when the skin is perfectly healthy. The irritation has entirely hijacked the nervous system, sending false mechanical alerts from the ears and the nose all the way down to the toes. Look at this chart. When we snap all these isolated points together, the worms, the shifting polyps, the moldy tastes, and the toenail pain, they collapse into a single diagnostic unit. They identify a singular state, the hyper-irritated condition known as Teucrium Marum Verum. This botanical illustration shows cat thyme, the source of the Teucrium remedy. It is used to neutralize this exact profile of intense, tickling hypersensitivity. By matching the extreme symptoms of the patient to the precise properties of the plant, the remedy acts as the structural counterpart required to calm the patient's uniquely irritated state. The Teucrium profile requires us to look past the standard medical view of treating localized malfunctions in isolation. It demonstrates a method of observation where bizarre, disconnected anomalies, like phantom toenail pain paired with shifting nasal polyps, are valued as the most critical information available. Seemingly unrelated physical ailments are often just local expressions of a single systemic imbalance waiting to be identified.